Welcome to Shoulder Camp, an educational presentation brought to you by your orthopedic team at the Missouri Orthopedic Institute. We would like to personally thank you for choosing MU Healthcare for your shoulder replacement. We are honored to have the opportunity to take care of you. In this presentation, you will find information about how to best prepare for your upcoming surgery, promote maximum healing, things to expect when you go home, and how to do everyday activities safely while you heal. The information discussed in this video is available to you in a written handbook that looks like this. You should have received this handbook the day you scheduled surgery with your doctor and clinic. If you did not receive a copy of the book, you can access a digital copy online at www.muhealth.org. Our primary goal after your surgery is to get you home safely after your surgery. Studies show that patients who are discharged to home sooner from the hospital have fewer complications from surgery, are less likely to be readmitted, and recover faster. These are also our goals for you. There are several things you can do now to make your transition home faster and easier. Here are a few things we recommend when preparing for your upcoming surgery. The more prepared you are, the faster you will recover. The first step to a faster recovery from surgery is preparing your body for maximum healing. When you stop smoking, your body will recover faster, reduce breathing complications during and after your procedure, help to prevent infection, and reduce your pain after surgery. You should plan to quit smoking at least 4 to 6 weeks before your surgery and stay away from others that also smoke while you heal afterwards. MU Healthcare offers a free smoking cessation program if you need help quitting. Email QUITNOW, QUITNOW, at health.missouri.edu for more details or to sign up for this free online program. Having healthy teeth and skin helps to lower your risk of infection after surgery. If you're concerned about any dental conditions, including loose teeth, check in with your dentist at least 3 months before your procedure. Be sure to take care of your skin in the weeks and days before surgery as well. Frequently checking your skin for scratches, cuts, wounds, or rashes, as these can lead to infections during your surgery. If you're concerned about an open wound, contact your doctor's office to discuss. Two of the most frequent reasons we see patients arrive for surgery with open wounds are from caring for pets and doing yard work, so take extra caution with these circumstances. When your body has the proper nutrition it needs, it helps you heal from surgery faster. Make sure you eat well-balanced, low-carb options to reduce your inflammation after surgery. Hydration is also very important, and although this sounds cliche, the better hydrated you are, the better your body can flush out any inflammation and help your shoulder heal faster after surgery. This doesn't mean you can't have your cup of coffee in the morning or a soda in the afternoon, but you should at least try to drink 6 glasses of water throughout the rest of the day. If you would like more information about meal planning, ideas for wellness, disease prevention, or would just like to learn more about better ways to help manage your nutrition before and after your surgery, call your dietitian services at 573-882-7000. We have many dietitians that are eager to help you reach your goals. Check with your insurance provider because many plans will also cover this consult. For patients with diabetes or those that have been told that their blood sugars are borderline, managing your blood sugars and A1C levels regularly will be of utmost importance after your surgery. When you control your blood sugars, you will heal faster, prevent wound complication, and help reduce your risk of infection. All these things mean that you get back to regular life faster. Check in with your primary care provider to help manage this condition. The second step to preparing for surgery is to identify the people in your corner, your team, in your squad, or also known as your support system. We encourage one of these people to come with you to your appointments before surgery, be with you on the day of surgery, and to stay at home with you immediately afterward. You may also consider putting together a list of friends or relatives that can run errands for you or take you to appointments until you can drive or otherwise get out by yourself. After having a shoulder replacement surgery, You will not be able to drive for a few weeks, so someone will need to provide transportation for you for approximately 2 to 4 weeks after surgery, depending on your surgeon's instructions. You should also consider arranging for someone to help care for any small children or pets, household chores, outdoor work, and other responsibilities until you're able to resume these activities as well. Typically, this will be after your shoulder has fully healed, which can take several weeks. Because you won't be able to transport yourself for a few weeks after surgery, it's important to stock up on necessary items in the weeks beforehand. We typically recommend having enough groceries and prescriptions to last a few weeks after surgery. You should receive an ice machine after surgery. Depending on what your insurance covers, you will receive one of two ice machines. One, you will have to refill the ice, and the other one you don't. Either way, you're getting one of them. If you are issued the ice machine that needs to have the ice refilled, one that looks like this, our recommendation is to freeze bottles of water with the labels taken off of them to use as your ice. This ice machine fits 3 to 4 regular sized water bottles in the unit. You fill the water around the bottles, close the lid, and the ice water runs through the connected hose and through the sleeve that goes around your shoulder. Our patients have told us that the water bottle trick can be much more helpful than using regular ice cubes, as most refrigerators and ice machines are not able to keep up. So just keep this in mind. Your surgery will only require one overnight stay in the hospital, so it's best to prepare your home now for when you return. Falling after a shoulder surgery is rare, but accidents can happen. So here are a few ways to prevent falling and injuring your shoulder at home. The list you see here can take some time and help to complete. So reach out to your support system, remember that squad again, for assistance if you need to. If you have a specific concern or would like someone to help you prepare your home, the Tiger OT program may be able to assist. This program is sponsored by the University of Missouri Occupational Therapy Program and is a great option for adults having functional challenges, those who are at risk for falls, or adults that will be having a major medical or orthopedic surgery in the near future, just like yourself. A licensed OT or occupational therapist and 1 to 2 students will meet you at your home to assess the current equipment, the safety of your environment, and provide a written report with any recommendations for any new strategies or equipment that you may need. Their contact information is listed here if you'd like more information. In the 2 to 4 weeks before surgery, you will have an appointment with your preoperative anesthesia team. Your nurse will review your past medical history and how to take your medications before surgery. Depending on your medical history, you may also meet with an anesthesia provider to have laboratory testing, an EKG, and a chest x-ray done to ensure your safety during surgery. In some cases, patients with chronic medical conditions such as heart or lung disease and diabetes will require medical clearance from their physicians. Your surgical team and/or your nurse at the preoperative appointment will tell you if you need to make an appointment with any specific specialists before surgery. Next, start practicing daily tasks with your non-operative hand. Your operative shoulder will be in a sling for a period of time, and you should avoid reaching with it or using it for several weeks. So daily tasks like brushing your teeth, cutting your food, bathroom time, bathing, toileting, and dressing will need to be done entirely with the other arm. A couple of things that may help are an easy to open pill box to organize your medications for the week, a floss pick, an easy pump bottle for any shampoo, conditioner, and soap, or even a reacher to help pick up items off the floor or hard to reach places, especially if you find that your balance has been thrown off by having one arm in a sling. Most of these items can be found at your local pharmacy, at your grocery store, at Walmart, or even online. Now we're 1 week until surgery. It's time to start packing your bags. Here's a list of things we recommend bringing with you to your surgery. 1 is loose-fitting clothing or a t-shirt. Many people suggest that you should bring a button-up shirt right after surgery. However, unless you are a one-handed wonder with buttons, in which case most of us are not, I would recommend bringing a loose-fitting t-shirt with elastic waistbands for your shorts or pants, as well as shoes with closed backs. If you walk regularly with an ambulation device like a cane or a walker, please plan to bring that with you as well. Any personal items that you choose to bring, such as toiletries, contact lenses, cases, glasses, or a CPAP machine, should definitely be brought with you as well. Comfort items such as crosswords, magazines, earplugs, a sleep mask, or a pillow, things that help you rest well, are also encouraged. You may also want to make sure that you bring a copy of your insurance card, an identification card such as your driver's license, and potentially a copay if you have any copays for medications afterwards. Here are a list of things that you shouldn't bring to your surgery. Blue jeans or overalls, as these can be very difficult to get on with one hand. Tight-fitting clothing for the same reason. Medications from home, because your nursing staff will take care of most of that for you when you're in the hospital. And any valuables that you would really not like to lose. Make sure that you sleep in freshly washed clothes and sheets to help prevent infection after surgery. Now, it's a great time to start regular skin checks to make sure you don't have any cuts, scrapes, or open wounds. If you do, you should contact your physician's office, as sometimes this can lead to a delay in your procedure. Make note that this may also be the time when your physician and your anesthesia team want you to stop taking certain medications before surgery. You should have found this information out at your pre-op anesthesia appointment with the nurse and with your anesthesia team. The day before your surgery, your nurse will call you to tell you what time to arrive for surgery. They will also review when to stop eating, drinking, and taking any medicine beforehand. Plan on arriving on time or early to give your nursing team plenty of time to prepare you for surgery. Be sure to shower following the pre-surgical prep kit instructions. This kit will be given to you either at the doctor's office or at your pre-op anesthesia visit. Make sure to clean especially well around your shoulder. It's common to develop skin dryness, but if skin irritation occurs, such as redness, itching, or any blisters, please contact your doctor. Remove any jewelry and also finish packing your bag. To help prevent infection, avoid sleeping with pets the night before surgery. And lastly, to ensure your breathing and vitals while under anesthesia, you should follow the preoperative instructions regarding when to stop eating, drinking, and taking medicines before surgery at that time. In some situations, certain medicines should still be taken before surgery and can be swallowed with a small sip of water. Your safety is of the utmost importance to us, though, so please be sure to make sure that you follow the guidelines prescribed by your nursing team and your physician's office to help prevent your surgery from being canceled or delayed. Welcome to your surgery day. On the morning of your surgery, be sure to take a shower following and using the cleansing kit again. Arrive on time or early as discussed with the nurse the day before. When you arrive at the Missouri Orthopedic Institute, you may either park on the valet lot at the east entrance or on the second floor parking garage in visitor parking. Your support team member and overnight bag should be with you when you check in. Once you've arrived for your surgery, here's what to expect. When you arrive, a team of nurses and anesthesiologists will start preparing you for surgery. This process can take 1 to 2 hours to complete, which is why we have you arrive early for your scheduled surgery time. Your support team member, such as your family or friend, can wait in the surgery waiting room while you're in surgery. Patient status boards are located in the waiting room for your loved ones to keep up to date with your progress. It's not unusual for total shoulder replacements to take 2 to 3 hours to complete once in the operating room. When your surgery is finished, your physician will meet with your family or friends to let them know how surgery went. You will be moved to recovery phase 1, where our nursing team will help to wake you up, resume normal breathing and blood pressure, and they'll also help you to control your pain. Once you're awake and stable, you will be transferred to a private room on our 3rd floor inpatient unit where you'll spend the night. And don't worry, we won't leave your family waiting in the waiting room. We'll bring them too. Your nursing staff on the inpatient floor will continue what your nurses in the surgery department had already started. They'll continue to monitor your blood pressure, your breathing, and your pain. They'll also start to gradually resume any other prescriptions you normally take at home. They will put ice on your shoulder immediately to help control any normal swelling that you may have. You do have permission to use the ice as much as you need while you're in the hospital. Just always make sure there's a towel, a pillowcase, or a shirt sleeve between your skin and the ice pack. A nerve block is applied to your shoulder before surgery as well. This is a medicine that's applied around your nerves and your neck to numb your arm that helps to control your pain right after surgery. If you've ever slept on your arm wrong and it falls asleep on you and it's this thing hanging by your side that's numb and heavy, this is what it will feel like right after surgery. Although many patients still have some feeling under the armpit even with the nerve block, so don't be alarmed if you have this because it's the only area that the nerve block can't get to. So you know that when you've slept on your arm wrong and it starts to wake back up, it's that tingly sensation that you get in through your fingers, which then moves up through your forearm, your elbow, and then up to your shoulder. This will be the same feeling that you have when your nerve block starts to wear off. The moment you are going to have the most discomfort after surgery is the moment that this nerve block wears off up through your shoulder. So when you start to feel your hand, your forearm, and your elbow, it would be a good time to tell your nurse so that they can give you more pain medicine. You want pain medicine on board before the nerve block has completely worn off up through the shoulder. The number one mistake that people make is that they wait too long to take their pain medicine because they're feeling fine until they're not. So work with your nurse to try and stay ahead of your pain. The nerve block can last up to 3 days after surgery, but everyone metabolizes medicine differently. And so many patients can start to notice it start to wear off within 12 to 24 hours after surgery, which would be while you're in the hospital. So you know that your nerve block is wearing off, though, when you start to feel the tingles through your hand, your forearm, and your elbow. The next morning after surgery, your nursing staff and your therapy team will help you sit up for breakfast in a chair or a recliner. Your therapy team will stop by on behalf of your doctor to discuss some of the instructions following surgery. A joint replacement surgery affects bone, ligaments, and muscles, which all need time to heal after surgery. For maximum healing and the best outcome, make sure your operated arm is relaxed at all times by your side in the sling. The number one rule after surgery, if you remember nothing else that I tell you today, is do not move your operated arm on its own for the next 4 to 6 weeks after surgery. What I mean by this is I don't want your operated arm reaching or lifting, particularly activities that make your elbow leave your side. The other hand can help support it, or someone else, like your caregiver or a therapist, can move it for you, but I just don't want the operated arm doing the work on its own. When your shoulder is allowed maximum rest, you recover faster. We'll talk about your sling more in a minute, but this also means you should always make sure that your elbow stays by your side for any activity, including those that are out of your sling, like showering and dressing. So what this means for daily life in the next several weeks is that there are certain things that you should avoid to maximize your healing, such as driving. We want your sling completely off and you off of your pain medicine by the time you're able to drive, which means there's going to be no driving for probably a few weeks. No pushing, pulling, or reaching with that operated arm. Lifting your hand to your mouth or your face, such as to eat, drink, or brush your teeth. Lifting or carrying greater than a pound. You will be on a 1 pound lifting restriction in your operative hands, so nothing heavier than your cell phone, the toothbrush, a remote, those kinds of things, as long as your elbow is staying by your side. And certainly trying not to sleep or lean on that operated side as well. Generally, we try to avoid running, jumping, jarring, and jerking motions because your shoulder needs time to heal. We want you to avoid any kind of swimming, hot tubs, or saunas that would submerge your incision in water. Aerobics and exercise classes should be avoided just temporarily. And activities where something is moving underneath your feet, such as a treadmill, an elliptical, or a stair climber. Any activity that requires you to reach with your operative arm should be avoided during this period of time. However, there are certain things that we do encourage you to do because we don't want you to sit on the couch for the next several weeks, but we also know that the show of life must go on. So we encourage you to do the activities after surgery that include light physical activity, such as walking, stationary biking with your feet, or even shopping. These activities help you to keep your circulation up, which also helps you to recover faster. Definitely make sure that you're taking frequent rest breaks. Typing and writing with your operative arm are allowed as long as your arm and your wrist are supported. Turning pages in a book or a newspaper, again, as long as your elbow stays by your side, or even cutting your food. The morning after your surgery, your therapy team will also help you with certain activities like getting dressed and adjusting your sling and practicing your exercises. An immobilizer sling will be placed on your shoulder right after surgery. When you wake up, the sling will already be on your arm, but it will need to be adjusted by our team once you're fully awake. Our OR team does the best they can to try and fit that sling to you while you're asleep, but it's much easier for our therapy team to make the final adjustments once you're awake. You should wear the sling at all times, including while you're sleeping, until cleared by your doctor to remove it. During this period of time, there are generally only 2 times where you can take your sling off: to shower or to get dressed. Otherwise, you should stay in your sling at all times. Which leads us to the golden question. How long will you be in your sling? Which has everyone's least favorite answer. Well, it depends. The length of time our patients are immobilized in their slings can vary widely from 2 days to 6 weeks. This is because each patient is just as unique as their surgery. So depending on the severity of your issue and the repairs required during your operation, your instructions for how long you should wear your sling may differ from the next person. Your therapist and your surgeon will give you specific instructions for when to remove your sling on the morning of your surgery, the morning after your surgery. So you will have this information by the time you leave the hospital. If you're not sure, please be sure to ask. First step is figuring out how to remove your sling. Watch this video as Jason demonstrates how to remove the sling from his operative shoulder. To remove your sling, you'll want to find a comfortable seat first. Unvelcro the strap over top of the arm, unbuckle around the waist, lean over and allow your arm to be supported on your leg, and unbuckle the last strap around your neck. You can sit up at this point, allowing your arm to relax. Grab a hold and secure your sling. Slowly stand up and allow the sling to slide off of your arm. Remember, your operated arm should remain relaxed at all times. The next step is getting dressed. Watch Jason as he slips on a t-shirt, like we talked about, for bringing to your surgery day, on his operative arm. To begin putting on a t-shirt or a pullover shirt, you want a shirt that doesn't have any zips or buttons unless someone else is helping you. In this video, the left arm has been replaced. You're going to bunch up the t-shirt until you reach the neck hole. Spread your feet so that they feel like they're a comfortable distance apart and can support you. You'll bend forward, allowing your operated arm to hang down in front of you. The sleeve goes on your operated arm first, in which case this would be Jason's left side. Pull up the arm and put your head in as well. In this position, you can also put in the other arm into the other sleeve. And then stand up and adjust your shirt. Your left arm should remain relaxed at all times throughout this activity. To get your shirt off, it's just the reverse. You will bend forward, allowing your operated arm to hang down in front of you. Grab your t-shirt from behind and pull it up and over top of your head, allowing the shirt to come off of the operated arm last. The last step is putting your sling back on. To put on your sling, you'll want to hold the sling with your thumb in the back pocket of the sling and your operated arm should be relaxed by your side. Bring your sling to your hand and slide it in, grabbing a hold of the small foam piece at the bottom of the sling. You will scoop up your operated arm and have a seat in a chair. Resting the hand in your lap. The pillow, if you have one, will go between your arm and your waist. So we will adjust the pillow here. At this point, we will lean over and put your elbow all the way down in the pocket of the sling. Now grabbing the strap that is attached to the back of your elbow, will come up and over your neck, around your neck, bending forward and buckling on the top of your wrist. You can sit up at this position. Now we grab the second strap, and this goes around your waist. Buckling here at the buckle in the front. The last piece of Velcro is directly over top of the sling. Rather than putting lots of tension on it, even though it is elastic, just simply lay it over top. The position of your sling should be the elbow positioned by your side. So if you are in this position, you'll need to move your sling over so that when you stand up, your elbow should be directly over top of your pocket. In which case, this one needs to be supported more here. And now we are directly over top of Jason's pocket. In this position, your forearm should be level with the ground so that your hand is not hanging down very far and your swelling doesn't collect down your fingers. The elbow should be firmly positioned all the way back in the sling. You know that you're in the right position with your arm when the buckle that's in front is located pretty well in line with your belly button or just off to the right. The morning after your surgery, not only will your nursing team and your therapy team stop by, but your doctor will also check in on you before you go home. If you have any questions for your surgeon, this is a great time to ask because you won't see his face again until the first follow-up appointment in about 1 to 2 weeks after surgery. If you have any questions before you see him again, though, please don't hesitate to ask your surgery team or call their office at 573-882-BONE. Congratulations, it's time to go home. There are still a few steps to help you best recover once you get there. Your surgical dressings and your wound care can be removed on post-operative day 4. But please do not cut any visible sutures or remove any white adhesive skin tapes, such as steri strips or butterfly strips, underneath. Sometimes the incision can be sensitive under your shirt, so once the bandage is removed, you do have permission to use a waterproof bandage over the wound daily for comfort. If you choose to use bandages, make sure you change the bandage every day. You should keep your incisions clean and dry until at least post-operative day 4 as well. So the good news is you can shower starting day 4. Prior to day 4, you can sponge bathe or use baby wipes on other parts of your body. On that glorious day, day 4, when you can finally shower, remove your bandages and your sling. Be sure to let your arm comfortably hang by your side and avoid reaching for soap or other items in the shower. When you're in the shower, just let the water run over top of your incisions. You should avoid any soap or scrubbing to the incisions, though, until after your stitches come out, which will be at your first follow-up appointment with your doctor in 10 to 14 days. Until then, it's more of a rinsing of the shoulder rather than a true washing. You can wash all the other parts of your body, and if you happen to get soap or shampoo that runs over the top of the incision, it's not the end of the world. We just don't want any scrubbing or soap directly to those incisions until after your stitches come out. A shower is preferred over a bath because we also don't want to submerge your incisions in water, such as with soaking in a bathtub, a hot tub, or a swimming pool, to make sure that your incision doesn't become infected. Please make sure that you avoid bathtubs, hot tubs, and swimming pools until you're cleared by your doctor. Remember to continue your healthy habits, a well-balanced diet, staying hydrated to help your shoulder recover faster. These things should look familiar from what we discussed earlier. It is pretty normal to have swelling and pain in your shoulder after surgery. After all, you did just have it replaced. These symptoms should gradually improve each day after surgery, though. In the meantime, here are some things that can make you more comfortable. It's everyone's own personal tendency to hold your shoulder up and very close to you, trying to protect it because this is my hurt arm. But keeping your shoulder shrugged and held close to your body can cause lots of tension in your muscles that can create lots of headaches and soreness in the shoulder that you don't need. So be sure to let your arm completely relax away from your ear and allow the sling to support the weight of your arm. Just another way of repeating rule number 1. So your shoulder will be the most comfortable and the least stiff if you keep the elbow by your side. Does this sound familiar? I think it probably should. But even if you don't take my word for it, studies have actually proven this. So we always want your elbow by your side rather than across your belly, even when you sleep. The sling will help to position your arm, but sometimes when you lay on your back, it can feel like the elbow and arm are going to fall backwards on you, which can be pretty uncomfortable to your shoulder. So roll up a small towel or a pillow just big enough to fill the space between your arm and the back of the chair or the bed that you're sleeping in. You don't want the fluffiest pillow back there because otherwise it'll push your arm across your body. So again, put something smaller behind your arm to help support the elbow and the upper arm. Your support team member can help you with positioning this. Number 2 is medication. Don't hesitate to take your pain medicine. It's there to make you comfortable. However, most patients are able to wean off of their pain medication relatively soon after your surgery. Talk to your doctor and your nursing team about when and how to best wean yourself off of this medicine and rather onto something that's more over the counter. While you were in the hospital, the ice machine ran continuously, including while you were sleeping at night if you needed it. Once you get home, though, you should reduce your icing time to about 15 to 20 minute increments, the same 15 to 20 minute increments that everybody's used to. So you can place the ice pack over your shoulder for about 15 to 20 minutes, still using the towel, the pillowcase, or the shirt sleeve between your skin and the ice machine. Then take the ice pack off for the rest of the hour. We encourage you to use the ice up to every hour if you need it. You just shouldn't sleep with it anymore once you go home. You are encouraged to use this as frequently throughout the day as you need, so it could potentially be every hour or could just be a few times a day. A TENS unit is not something that's necessarily required after surgery. However, it can be helpful when the previous 3 pain control techniques are not sufficiently reducing pain after surgery or when you're trying to wean yourself off of the pain medicine. So a TENS unit is an electrical stimulation unit that places electrode pads around the sore joint. These electrodes hook up to a small battery pack. When you turn the unit on, you'll feel a tingle up underneath the pads. What the TENS unit is doing is it's talking to the nerves in that area, gets your nerves to calm down, which helps to reduce your pain. Some insurance plans cover these. However, there are also affordable options either online or in the pharmacy if you'd like to purchase one. If your insurance plan covers this unit, a member of our team will provide you with a TENS unit before you leave and show you and your family member or your friend how to use it. Refer to the shoulder replacement handbook for a photo of where to place your pads. So how all of these things work together. Pain medication can typically be taken approximately every 4 to 6 hours after surgery. If you're having trouble getting to the next 4th or 6th hour when you can take the next dose of pain medicine, or if you're trying to wean yourself off of that pain medicine and go a little further before you would need your next dose, consider using your ice machine and your TENS unit together to help bridge the gap between your pain pills. Many patients also use the ice and the TENS unit to help treat symptoms like dull aching or soreness that doesn't necessarily warrant a pain pill. I realize we're telling you to use ice and electricity together. However, this is safe to use at home. Just make sure that you don't shower in the TENS unit and you keep the TENS unit pads dry at all times. The sooner you are off of the heavy narcotic pain medication, the better your whole body will feel. So don't hesitate to use these other two options to help in that process. Out of work expectations after surgery are highly dependent on what kind of work you do. If you're able to complete light duty tasks without the use of your operative arm, you may be able to go back to work sooner than someone who does a lot of heavy lifting. Your therapy team, specifically your occupational therapist, will prescribe exercises to do at home while you heal. These exercises are designed to help keep the other joints around your shoulder nice and mobile while we're waiting on that shoulder to heal. The magic in these is not in doing them once, but rather frequently throughout the day. The more you've done them, the better you're going to feel by the time your shoulder is healed and ready for movement. So keep in mind that your arm should always follow still that rule number 1 and remain relaxed at all times. Also, while some of these exercises may be hard or somewhat difficult to do, they should never be painful. So if they are painful, please call your doctor's office for suggestions. The first set of exercises will be for your neck and your elbow and wrist. First one is neck rotation, turning your head from side to side as far as you can in each direction. A neck tilt, tipping your head off to one side and then tipping it off to the other. Remember, I mentioned that it's not uncommon to get a lot of tension in the top of that shoulder leading up into your neck after having surgery. This is a good way to help stretch that out. You can rub, massage, stretch this muscle out as much as you need to on top of your shoulder. You're not going to hurt any part of your surgery. Hand gripping. You'll have a little piece of foam at the end of your sling that you can squeeze and relax. Otherwise, you can use a stress ball or a pillow. Elbow bending and straightening. You are fine to bend the elbow on its own, using the other hand for support if it needs it to help get it a little bit further, and then let it fully relax down by your side to fully straighten. The next set is going to be for your shoulder blade, your upper back, and also a little bit more of your wrist. The first one is a shoulder blade squeeze. Your sling will have a tendency to pull and round you forward into a slouched position, which your shoulder is not going to like very much, and neither is your back. So these first two are just trying to get you up and out of that position so that everything's a little less cranky. The first one is a shoulder blade squeeze. You'll squeeze back and down as opposed to back and up, because back and up gets that shrug going again. Are you seeing the theme here? No shrugging? Thoracic extension. Roll up a towel or a pillow, put it about mid-back or about bra strap level against either a hard back chair or a wall, and you'll just gently lean your back against it. The last two are for your wrist, taking that wrist up and down and then that palm up and down. There may be some additional exercises that are prescribed to you in addition to these, but your occupational therapist will review those with you once you're in the hospital. Every shoulder replacement, however, will be receiving these 8 exercises initially. The need for outpatient therapy, once you have gone home, is different for each patient and procedure. Here's our favorite "it depends" answer again. So your need for therapy in an outpatient clinic is decided between you and your physician and based on how quickly you recover after surgery. Ultimately, your doctor will tell you ahead of time if he thinks you would benefit from this service. Physical therapists can help you with strengthening your arm in order to do the normal tasks that you want to do at home or at work. They can help you regain motion in your shoulder if you're having trouble getting there on your own, and they can also help to reduce any remaining pain in the joint. Ultimately, your orthopedic team's goal is to improve the function in your arm so you can resume normal life again. So what should you expect after surgery, and how much function should you regain? Because of healing time and is different for each person, most patients can expect a full recovery from surgery and return to pre-injury activities, with the exception of a few things, within 6 to 12 months after surgery. The success of your surgery, though, is highly dependent on each individual's circumstances, but also by your dedication to following the postoperative plan set by your orthopedic team. We want you to recover quickly and resume regular activity to the best of your ability. You should expect your progress to be gradual and improve over time rather than overnight. Most low-impact activities like walking, biking, hiking, and golf are allowed approximately 5 to 7 months after surgery. There are some circumstances that would make your surgeon recommend to not do certain activities. Again, this is a little more dependent on your specific condition, so asking your doctor if you have questions is best. However, participation in most contact sports, such as rugby, football, and wrestling, are generally discouraged to protect your knee joint. On to some frequently asked questions. When do I follow up with my doctor? Most patients follow up with their doctor within 7 to 14 days after surgery. You will already have this appointment scheduled for you by the time you leave the hospital. At this follow-up, your doctor will remove your stitches, give you any instructions for exercise and activity level, and make sure that your incision looks like it's healing well. When can you return to work? Again, this is highly dependent on the type of work that you do. Most light-duty tasks can be done after surgery. How long do I wear my sling? This varies based on your surgery, but regardless of how long you're in your sling, remember the number one rule still applies. Do not use your shoulder for reaching, lifting, pushing, or pulling for probably about 4 to 6 weeks after surgery. Do you have any lifetime restrictions? Generally, we recommend avoiding any kind of activity that involves a lot of impact or sudden force on your arms, such as chopping wood or driving fence posts. Any type of contact sport like football, rugby, and wrestling that we just talked about, or lifting heavy weight. How you know it's heavy weight is that you should be able to lift something 15 to 20 times without issue in order to be allowed to do it. If you can't lift an object 15 to 20 times relatively easily, that should probably be avoided. For a list of more frequently asked questions, please feel free to visit our website at www.muhealth.org. There are more information listed on this page. Do you have more questions? Please feel free to call us at 882-BONE or submit your questions to your doctor through the MU Health Connect app. We hope you enjoyed this presentation and found the information helpful in preparing for your upcoming surgery. You are welcome to refer back to this video as many times as necessary before and after surgery, and we hope that you'll share it with your support team as well. If you have further questions, please do not hesitate to reach out. Thank you for your time, and we look forward to seeing you at your upcoming surgery.